National Epilepsy Day. Neurologist and epileptologist in the Department of Neurosciences at Aster Hospitals, who's going to be talking.
Something when which the brain suddenly there is a rush. So the comment on what type of seizure is there. So broadly speaking, there are two seizure types. The first type being generalized seizures, and second being focal seizure or partial seizure. It all depends from where in the activity starts. Yeah, so symptoms what the patient, in particularly uncontrollable jerking movements of the arms and legs, which commonly we call as fits. Other symptoms can just have a staring. Sometimes patient lose consciousness and they sometimes lose awareness and they pass urine and sometimes motions without them being noticed.
Right.
Other patients have some they have increased fear during the episode, anxiety, and some people complain of some strange feelings like something, noticing abnormal smell, noticing abnormal taste. Sometimes they feel something ringing in the ear, etc.
Important information. This is the afternoon show with Mirchi Sara. Epilepsy Day with Dr. Keni Ravish Rajiv, consultant neurologist and epileptologist in the Department of Neurosciences at Aster Hospital. So, doctor, if you can tell us about some of the myths that are associated to epilepsy.
So I'll just tell about the myths and the facts.
Right.
The commonest myth is that epilepsy is believed to be caused due to evil spirit, and people sometimes even they venture into sorcery. The fact is that this is a big myth, and epilepsy is a neurologist stops by itself within a few minutes, and by holding the person, there is a risk that a patient may injure himself by getting some fractures or dislocations. So what we should ensure is that instead of holding a person, we should ensure that the patient is turned to one side when his seizure is there, and the surrounding area is cleared by removing some sharps or harmful objects like furniture, which can potentially injure.
Right. If you can tell us about what are the treatment options, that people can opt for, especially those who are suffering from it, so that
that causes seizures when medicines don't work. Epilepsy, they are as good as anyone else. They can lead normal. Should ensure that certain precautions are taken. Mainly, they should ensure that they took medicines which are prescribed and they follow good lifestyle, which include sleeping adequately, taking the food on time, taking plenty of water, and ensure certain drugs, certain over-the-counter medicines, and certain substance drugs like alcohol, smoking, etc. are avoided.
As long as precautions and a good lifestyle is led. Keep it locked to 95 Mirchi on the afternoon show, Mirchi Sara ke saath.